Hello, I'm Dr. Kumar, Medical Director of the Vascular and Vein Center. I'm a board-certified cardiologist and a vascular specialist, serving Kern County for over 20 years. Today, I'm going to walk you through a short video that we have put together to help you understand this procedure. The procedure we do now is minimally invasive. It's a non-surgical procedure, does not require anesthesia and no hospitalization. It can be done in an outpatient setting and takes 30 to 60 minutes. So what are the veins? Our body has two different kinds of tubes that make part of the circulation. One is called the arteries that bring the good blood from the heart to the tissues, and the other one are called the veins. These veins carry this bad blood back to the heart and the cycle continues. Now, let's examine what's happening in your leg. In your legs, these valves are not functioning, and so the blood is trying to go back to the heart, but it falls down. All day this happens, and by the evening, there's a lot of bad blood which has accumulated in your legs and feet. That makes the foot swell. This is why you might be feeling heavy sensation, cramping, aching, or burning in your feet. While you sleep, the body tries to push this blood back up to the heart, which is why when you wake up in the morning, you feel better and lighter. Unfortunately, by the evening, the same symptoms come back and the process continues. If this process continues day after day and years after years, this accumulated blood can damage the skin and the tissue in the legs and feet. Even it can cause sometimes the ulcers, leading to unhealthy legs. Until few years ago, we used to do what we call is vein stripping. This is a surgical procedure that is done in the hospital under general anesthesia that requires several days of the hospitalization. Thanks to the modern times, we don't have to go through that. So how do we treat this condition? Well, the goal of treatment here is to have a good flow of the blood from the feet up to the heart. Sometimes we elevate the legs and then gravity pulls the blood. Usually that's not enough. We use compression stockings. They compress these veins and try to bring the natural shape of the veins so that the valves hold the blood column and does not let it fall. But that usually works only while the compression stockings are on. Sometimes these conservative measures fail. So let me walk you through this procedure.
Varicose veins are enlarged veins in the leg, most often caused by chronic venous insufficiency, or CVI. CVI is a progressive medical condition where veins that carry blood from the legs toward the heart no longer function effectively, causing blood to pool in the legs and the veins to swell. Typically deployed through a 4 or 5 French microintroducer under ultrasound guidance, the catheter tip shows brightly. Upon activation, the unique rotating ball dispersion tip rotates at approximately 3,500 RPM, creating a targeted penetration of liquid sclerosant leading to vessel closure.
Procedure time. You'll be in the office for approximately 1 to 2 hours. Recovery. After the procedure, we bring you to the recovery room. We dress the site, put the compression stockings, and you walk for about 20 minutes around the building and you go home after. How about downtime? In most cases, there is no downtime. Preparation. Take all medications as you routinely do. If there are any special instructions, our medical providers will instruct you accordingly after this video. We recommend you bring a family member with you, although typically you may drive to and from the procedure safely. If you have any other questions, feel free to ask the scheduler and she will connect you to one of our providers.